discussions later on. So,
all right, thank you, Benjamin. So we're going to begin real quick with just a brief introduction. Benjamin's given you an overview of what Assist International is doing in the response to COVID-19. Thank you again for joining us today. This is our first step and we're very excited. We're going to talk a bit about personal protective equipment and disinfection. At least to us on our end, as engineers and as biomedical professionals, we know that protecting you on the front lines is the most critical piece before any maintenance, any corrective maintenance, any preventive maintenance begins. And everything that you do affects the patients and the doctors as well. So we're going to try to prepare you as best we can so that you can go out confidently and safely. Go ahead to the next slide, Guna. As we've mentioned, we are recording this session. You can email us at assisthtm@assistinternational.org for access. You can feel free to share this session recorded and the PowerPoints with your friends and colleagues. We want to make sure that this information is freely available to any engineer, any technician who needs it. We'll provide access so that you can send it to your friends and colleagues. We just ask that you don't sell it. Go ahead, Guna. A few etiquette notes for people who are new to this platform. The foundation of our conversation today is love and respect. Respond kindly rather than react if you disagree. It's everybody's responsibility to keep ECHO a safe space. Feel free to test your equipment ahead of time in the future. And please introduce yourself before speaking so we know where you're from. We're going to turn off video call, but make sure you're also muted when you're not speaking. At the end, when we open up discussion, you can feel free to unmute yourself. Guna? If you need help muting your microphone, by the way, it's in the bottom left corner of your screen. We can also mute you from the administrative side if you're not sure. Other notes, you can speak close to the microphone so we can hear you, and if you have IT issues, feel free to send a message in the chat. You'll find that dialog box to the right, or you can open it from the bottom of your screen. With that, we'll move on to the agenda. Today, we're going to talk briefly about personal protective equipment and disinfection. Guna will lead that discussion. I'll hand it over to him next. And then we will open for discussion. If you have questions, you can keep track of them as we go on. Write them down, put them in the chat, and then we'll get back to them after. Until the didactic is over though, please keep your microphones muted. And Guna, you can go ahead on to the learning objectives. Our goal today is to first understand the transmission of the COVID-19 virus and why it's so dangerous. We want to utilize proper personal protective equipment and understand the medical equipment necessary to treat patients with COVID-19 so you can effectively plan your work. We also want to talk about disinfecting equipment properly between patients. We've based our presentation today on a series of resources from WHO, NIH, and PAHO. I have links here, and once we send you the PowerPoint, you'll have access to those as well. And with that, I'll turn to COVID-19 awareness. Just a brief overview of some of those resources we've listed. Go ahead, Guna. So the first section on this document is surveillance. This is a screen capture of that document. Next is triage and screening. We won't talk very much about those. They're basically for clinical use, but we will talk quite a bit about case management. Case management, as Benjamin mentioned, is mostly about oxygen therapy. So the devices listed on the left are key priority equipment that you'll need to prepare for your clinicians so that they can treat their patients properly. And on the right, there are some recommended supplies. All of this is from WHO, and you can reference the document after. We will base our series of PowerPoints on the equipment on the left. Today, PPE and disinfection, as it is one of the keys in maintaining all of these devices. So today what we're going to cover, First, an overview of the natural history of COVID-19, some standard precautions that we should always be taking as biomedical professionals. We'll also talk a bit about transmission-based precautions specifically for COVID-19, as well as the risk evaluation of personal protective equipment, requirements for use in different situations, and then routine decontamination of reusable, non-invasive patient care equipment. And with that, I will turn it over to Gunalyn Das, our instructor. You can take it from here.
Hi, everyone. We're going to start with the personal protective equipment, like what Aaron mentioned. First of all, I'm going to explain about the natural history of COVID. So basically, you are talking about SARS, MERS, and COVID-19 is the virus that's spreading around. Currently, COVID-19 is a big issue. So when you talk about the chart here, you're talking about reservoir. So basically, reservoir is where the organisms surviving and residents, like ventilation system, surface, all this. Okay, then the place that where they live from the reservoir, from the mouth, all that, and transmit to one person to another person. So basically, by touching something and you holding on your mouth, on your face, all that, you can transmit the particular virus point to point. Okay, then portal of entry basically can be from one person to another person. Okay, so it can be from droplet, airborne, direct and indirect contact, all this. Then the carrier is basically can be a elderly person, a person who body is weak, with a risk, all that. So it carry to by the patient and with a critical condition, all this. Okay, standard precautions basically advice stand for civilian and professional. Basically, avoid contact with the people who are sick. That's very common thing you need to do. Avoid touching your eyes, nose, and mouth. Stay home if you are sick. Practice social distance, especially if your age, underlying health condition put you at high risk. So be careful with that. And social distance, basically now most of the country having a lockdown. So that is a big thing. So just follow the rule of each country, all that. And cover your cough or sneeze with tissue, then throw the tissue into the trash, all that. Okay, and clean and disinfect frequent. Touch object surface using a regular household cleaning spray, and very important, wash your hands. That's one of the very important things. Standard precaution, the steps. Okay, set a practice that you need to do regularly. So regardless of the state of infection, all this, make sure that you follow certain recommendation that as a clinician or biomedical professional, all that, make sure that you, and hygienic, water, soap, alcohol-based solution like hand sanitizer, all that, please use regularly, and please make sure that you practice this. Use of personal protective equipment, PPE, according to the risk. Okay, so respiratory hygienic, the way you cough, close your mouth or by using your shoulder, and practice safe injection, sterilization, all this. So sterilizing and disinfecting of medical device is very important, and environment cleaning is very important as well to make sure it doesn't pass to another patient or another person. So what's so dangerous about COVID-19? So the virus is basically can stay very long on certain area, like aerosol up to 3 hours, copper up to 4 hours, cardboard up to 24 hours, plastic and stainless steel up to 3 days. Basically, if you got something plastic surface or something like that, it can stay up to 3 days. If you wrongly touch and you're going to use your hand, touch your face or anything, that can transmit your COVID-19. Okay. So when you talk about personal protective equipment, as you know, PPE is very common for biomedical engineer to use. Normally, you guys love to use glove and face mask, all that, but for COVID, you need to follow certain guidelines. You need to make sure hand hygienic, glove, gown, and medical mask, all this, and protecting Google, all this, your cover your face and your shoe. Okay, when you talk about transmitting based on precaution, contact precaution, droplet precaution, airborne precaution, basically you're talking about this. General principle of PPE and hygienic is very important. Always make sure perform and hygienic, wash your hand, all that. And remove and replace damaged piece of reusable PPE. Make sure your reusable PPE is not damaged and check before you use. Okay, so remove all the PPE as soon as after completing whatever work you do, like cleaning the equipment, all that, remove it and throw away. Okay, and all the item that you use, make sure it's hygienic, carefully perform and hygienic immediately after. Okay, glove and shoe cover is one of the important part PPE during COVID. So you're talking about glove cover and shoe covers. Basically, you use glove. So when you touch anything, you're not going to get a direct contact with the fluid, patient fluid. That chances of infection is very high. So all this can be removed. Okay, and the glove cover is basically if you're using shoes, but you can move around, so you can carry the virus or whatever, move around and basically contaminate the hospital, your home, all that. So the best thing to use is the glove cover to reduce all this movement. Gown or apron are additional thing that you need to use to protect your body, all that. But at the same time, the best thing is don't use your clothes. Try to use this particular gown and cover it properly, because sometimes you're going to carry back whatever things like droplet, all this. So use it properly, cover everything, and using a plastic apron for additional work. Facial cover is basically you are talking about mask, eye protection such as eyewear, goggles, all this. Okay, so basically you don't want any droplet touching your face, all this. So that's a key thing actually. So this is how you put on your PPE accordingly. Your face mask, all that, and you're covering your by using mask, all this. And when you're taking off your PPE, make sure that you avoid any contact the PPE to your body. You remove your gown first and your glove, all that, and wash your hand and remove your face mask, all that. Okay, droplet precaution. Basically, you're talking about masks. So that's you wear mask within 1 meter range But some places they are practicing 1.5, 2 meters, depends on your regulation as well. Okay, put your patient in a single room, in the room that contain only other patient with the same diagnosis. Basically, if the patient are COVID-19, make sure all the COVID-19 are in the same area. You isolate them. Okay, you cannot mix with the other patient. That's how it works. Okay, ensure that transportation of the patient area outside and designated room. Keep to minimum. Okay, perform hand hygiene immediately after removing the medical mask. So make sure when you remove, you wash your hand. And airborne precaution, respiratory precaution, you are talking about N95, all this type of mask that you don't want the airborne and the droplet move around. So basically you are putting on this type of mask is normally very important when you got aerosol procedure, all this. It's better to use this. Actually, normally these are very important because you don't want the airborne go through your mouth and your nose, all that. So how to perform particular respiratory seal check is basically you are using the N95 mask, put the first step on the top of your, at the back of your head, and check the particular clip, whether you lock the particular clip on the nose properly, all that. Okay, use of PPE according to level of care. So these are basically you're talking about type of level of care. So when you talk about COVID-19, you need to follow hygienic gown and respiratory N95, goggle, glove, all that, and head cover, shoe covers, all these are very important. Okay, disinfection. So basically, when you talk about disinfection, normally you're going to use ventilator, all this medical equipment with a COVID patient. Okay, ventilator, patient monitor, suction, all this. So any piece of equipment used in providing patient care must be handled with care, as it may be contaminated and have potential of spreading infection. So as a biomedical engineer, you have to be careful with this, because chances of, if you're not going to follow PPE rule, you're going to get infected. So you have to be careful with that. Okay, general principle, remember when you're handling contaminated, use patient care equipment. Even though you think the clinician have cleaned all that, but it's your responsibility as well to clean it before you do any testing and check. Okay, so it's important to avoid any contact between the used piece of equipment and skin, mask, and clothing of healthcare worker. Basically, when the healthcare worker going to clean, make sure they are using a particular PPE as well. Okay, because you don't want the healthcare cleaner work going to get infected as well. Okay, so the process of cleaning disinfect respiratory equipment frequently used in splash, which could potential contaminated. Basically, fluid, all this touching the medical equipment. So we have to be careful with that. Okay, when cleaning and disinfecting respiratory equipment, the healthcare worker or BMAT should wear rubber glove, gown, apron, face protection, full face shield, eye protection such as visor and goggles, and face mask, shoe cover, air cover, caps, all this. Okay, you need to wear this type of things because you are moving in the COVID-19 area, so you're going to get droplet or aerosol, all this. So you need to fully protect yourself before you enter that particular area and removing the medical equipment, cleaning, all this. Okay, patient care equipment should be single-use item if possible. So basically, you're talking about non-invasive equipment must be decontaminated between each patient and after patient use. Okay, after blood, body contaminate or regular interval part of equipment cleanings. For example, is ICU bed, you need to clean them every time when a new patient come in. So you need to do that particular part. ICU bed, equipment, all this. Okay, when you talk about ventilator, you should be protect with HTM filters, reusable breathing circuit, should be autoclave, suction closed system, suction should be used, replacement of tubing, replace of bottles, patient monitor, ECG sensors like SQ2, all these need to be clean. Okay, when you talk about cleaning and disinfection, clean and disinfect all the equipment between the use. Throughout cleaning respiratory and reusable equipment area for disinfection. Okay. Healthcare worker must use PPE for cleaning and disinfect all the equipment. Okay. Basically, if you got people are cleaning the bed, all that, they need to be protected as well. Okay. Keep clean and disinfect item dry in the individual packets whenever possible. Okay, filter and breathing circuit. Okay, most of accessory are consumable, are single use, like breathing tube, breathing mask, all this. So make sure that single use, like bacteria HEPA filter, HMFE filters, all this, cannulas, all this. Okay, sterilization is preferred method on decontamination. So basically, when you talk about certain breathing circuit are reusable, so they're going to use sterilization method. Okay, that's a temperature 121 15 psi for 15 minutes for heat sensitive item like rubber and tubing filter, and 132 Celsius psi for 3 minutes for item that will not melt in a high heat. Okay, so most of this particular breathing circuit, they got a mark on the particular circuit. That's what's the temperature you can sterilize. All the details are there normally. Okay, but you have to remember, you must clean the item properly before disinfect or sterilize. Okay, because if you don't do it, you don't clean it before you put it into your sterilization, that particular process won't be very good. Remember that. Okay, disinfection. When you select disinfect reprocessing medical equipment at care setting, consider the following: the piece of equipment to be disinfect, the composition of piece of equipment and its intent to use, the level of disinfection required, then availability of capacity of the service and physical facility, organization resource, and personnel. Okay, so when you talk about body contact, intact skin, disinfection requirement, low level, so FDA device class non-critical, and muscular membranes high level, semi-critical, and sterilized body cavities sterilization is critical according to the FDA device class. Okay, disinfection, high level of disinfection use product that include one of these following. So basically you're talking about type of chemical that you can use during this process, like glucuronidine, hydrogen products, prussic acid, hydrogen products, xylate, fluorides, all these are type of chemical that you can use. Okay, disinfection availability may vary according to the country. So we're talking about like respiratory equipment, high level disinfection generally for environment cleaning, bleach, and all these chemical are used for the infection. Do not use bleach, chlorine on the steel surface, such as surgical tool, steel machines, and this will corrode basically. Basically, you cannot use any on any metal surface with bleach. To use chemical granulate such as bleach or physical method such as autoclaving is usually sufficient enough. Okay, cleaning must be precede any eye level deinfection activity, or disinfection will be ineffective. Okay, so example like Clorox, Granulate, Dettol, Medicina. This is sample of photos that we have here. So basically, you got Dettol, that will be advantage, and Clorox, all this. Okay, how to clean LCD screen? Okay, yep, you guys have to remember LCD screen. Normally, what happened is we intend to do it wrongly and ended up you get a screen issue later on. So make sure when you start to clean LCD screen, so mix equal part of isopropyl alcohol and distilled water in clean spray bottle of the patient monitor or the ventilator unit. Make sure it cool off before you start your procedure. So make sure the screen wait for a while and cool off. Spray some cleaning solution direct into the microfabric cloth, not to the device screen. Yeah? And wipe the patient monitor LCD screen gently, but throughout from top to bottom. So that's a method of LCD screen cleaning. And cleaning and deinfection mechanical ventilator. First step, make sure you are using PPE. Same thing goes to the patient monitor. Make sure you use your PPE before you start anything. Okay. Power off your ventilator and ask the user if they are using single-use circuit or reusable. Sometimes the biomat itself, by seeing, they know it's a single-use or reusable, because you can see certain marks that indicate reusable. If single-use, dispose the breathing circuit and filter. If reusable, dispose the filter and disassemble the tubing and clean with the detergent, rinse, and perform eye-level deinfection or sterilization. For the screen and metal plastic surface, spray some cleaning solution directly into a microfabric cloth and wipe the ventilator device gently, but throughout from the bottom and side back of the device, all that. Clean it properly. Okay, allow to dry and replace with the new filter and patient breathing circuit, or sterilize patient breathing circuit if reusable. Then power up, test run the unit with test function with test lung. So you see whether it's functioned properly, all that, to make sure the device is ready to use. Next, basically a stage of involve reprocessing reusable accessories and consumable are follow according to wash the item with soap or detergent and water, rinse with distilled water if possible, and rinse again and disinfect, rinse again with the used chemical to disinfect other than alcohol, dry and storage. Okay, this process can be used for items such as bed, reusable accessories for suction pump and ventilator, similar non-electrical and non-cable item. Autoclaving is preferable, but this method is second best for a case where there's no autoclave. Okay, if you don't have autoclave, this is the one of the best method. Environment cleaning. So when you talk about environment cleaning, is your basically your ICU area, all that. All horizontal surface area where care been provided to the patient must be cleaned every day, and whenever visible soil, it must be cleaned whenever the patient discharged before a new patient arrives. So it's a daily routine. So you make sure that it's clean daily. If the surface had direct contact with the patient, such as exam table, other equipment, surface must be cleaned and disinfect between the different patient. All clothes used must be damp before dusting with the dry cloth, or sweeping may lead aerosol matting, so it can airborne. So normally avoid sweeping the area because it can airborne and cause infection, all this. Okay, solution clothes and mop head should be changed regularly according to the local health authority policy. So if your hospital got any local authority policy, you have to follow that particular thing, but at the minimum. All the cleaning equipment should be cleaned and dry after each use. Reusable mop head should be laundered and dried after use before the storage. Make sure it dry and then only can go to the storage. Area around patient should be kept clean from unnecessary equipment, supplies, and clutter to allow through daily cleaning to take place. Okay, example, table surrounding equipment have been used for patient unknown or suspect with the infection. Potential concern should be wiped down with the disinfection immediately after use. So basically after use, make sure you disinfect that particular area, table, or whatever. Okay. It's also important to note that good ventilation of the area is necessary during immediately after process of disinfection, regardless type of the disinfection use. Good ventilation look like positive pressure, proper air filtration. Bad ventilation look like windows and door that open into hallway and room with people in them. Environment cleaning process. So basically these are normally done by the cleaners, all that. So put on gown, apron, rubber glove, the PPE itself. You need to use all the PPE. Clean the surface area with water, detergent using disposable cleaning clothes. Dispose of the cleaning cloth appropriate leak-proof waste container. So basically you need to you don't want any leak when you dispose all this cleaning cloth, all that. So you don't want spread on the surface, all that. Okay, on the disinfection area, sodium hypochlorite can be used for disinfection, concentrating ranging from 0.05% to 0.5 are suggested. Remove the rubber glove, apron, and dispose both items into an appropriate container for further cleaning and disinfection. Remove the gown and place into a appropriate container as well. And perform hand hygiene. And already come back to the hand hygiene. Make sure you wash your hand. Okay, summary, everyone should practice basic hygienic and social distance. Right now, social distance is a big thing going on. So make sure keep the social distance 1 meter above. Some places they ask 1.5 or 2 meter. In hospital setting, clinical area, and biomedical professionals should adopt the following in additional standard procedure. Increase frequent basic hygienic like hand washing, increase use of personal protective equipment to protect against droplet, airborne infections such as respiratory and face masks, and increase frequent of equipment disinfection. Okay, remember the virus can last up to 3 days on some surface. So be sure you use proper disinfection and recommended by CDC and WHO, and autoclave material at high enough temperature for long enough. So make sure that keep it safe. Right.
All right, I'll take it from here. Thanks,
Yep.
Dina. I want to give a special Shout out to Christina Fast from SPECT and the Assist International staff that helped put this together. We're very grateful for the help. And we'd like to open it up for discussion now. We went through a lot of information very quickly, so we want to make sure there's time to ask questions and answer questions. You can either put them in the chat or you can unmute yourself and speak. If you're not in a place where you can speak comfortably, you can put it in the chat and one of us will ask your question for you. I see someone's asking where we can sign in to keep track of attendance. You registered when you joined the call. So everybody who submitted their name and email address, we have your attendance recorded. I see a raised hand. Abraham, would you like to speak?
Good afternoon or good morning. Hello?
Morning. We can hear you.
Yes, we can hear you.
You can hear me?
Yes.
Do well.
Yes.
Yeah. Okay. I have. First of all, thank you very much, Assist International, to organize this session. I really appreciate on behalf of my colleagues in the field. Thank you again. When I go to my question, I have a question. At the beginning, you said we have to keep the same patient with the same diagnosis. What does it mean? Is it the same patient who is having the virus with similar time, dosage, or date? I didn't understand.
Okay, when you mention about same patient, basically same type of patient that carry the virus, basically COVID-19. Basically, if you diagnose the patient have COVID-19, you only can keep the COVID-19 patient in that particular area. You cannot mix with other diagnosed patient, like maybe they got some fever that maybe or something else. So you have to isolate them separately. That's what it means.
Okay. So there is no problem with the duration when they are affected. Like one patient has been affected 2-3 days ago, and a new patient has affected just like today. So we can keep both patients in the same room or in the same area. Is it possible?
If they are positive,
yes,
they should be in the isolated area. They cannot mix with the other patient because they are positive. Because when they are positive, they can contribute to other patient, the non-COVID patient.
Okay. Then we do the same thing to the equipments. We keep the equipment in the same place whenever there's a new patient is arriving.
The equipment, if you're using for the COVID patient, is rather be with the COVID patient thing. Don't mix. That's the best thing, because it's easy to justify if the equipment is used for COVID patient. Then the biomedical or the cleaning people don't get confused with that.
Okay, thank you.
Welcome.
Gunnar, can you move to the ventilator patient circuit slide, please? Can we go over again how biomeds can know at what temperature and pressure a reusable component of a patient's circuit should be sterilized?
Hi. The reusable sterilized circuit can be sterilized because the reusable is they have written on that particular tubing what's the temperature can be sterilized normally.
And so is this something that, where would they get? So, I mean, we have the 121 Celsius temperature or the 132. and we have the PSI information. But is there another way that they can reference those, a very specific PSI or a very specific temperature for the reusable circuit at their facility?
Okay, normally when you talk about reusable circuit, it's basically, you can see on the manual itself, it's written, because it comes with the particular device. So it's written about what's the temperature you can use, what's the pressure you can refer to, and you can set on your sterilize accordingly.
And is this information also available on the packaging you had mentioned, I think earlier, about whatever packaging the circuits come in, if they can keep that, they'll probably capture some information on that?
Yes, they have on the packaging itself. That's like a small manual that mention what's the temperature, what's the setting you can use.
Great, thanks, Guna. Are there any other questions? I see some BMETs joining in from Tanzania. We have BMETs joining in from Uganda, from Ethiopia. Feel free to ask any questions you have.
Well, thanks. My name is Benedict from Musoma, Tanzania, the head of biomedical department and our engineering team. First of all, I'm so happy that I've seen the people whom we have invited, they're in. Thank you so much for accepting our invitations. And second, I had two questions when before the presentation on the PPEs. But one is answered because I wanted to know the type of PPEs which I use for BMET when we go to do maintenance for the machines which provide oxygen to patients who are affected by COVID-19. But the second question, I wanted to know, are we using the same PPEs, as doctors' PPEs? I just wanted to know this. Are we using the same kind of PPEs, and the PPEs for single use? This was my question to you, sir, Mr. Guna.
Single-use PPE is the best because you don't want to reuse again. That's the best method because you don't want the virus stay around. So single-use is the best. And your PPE is almost similar with the doctors, but sometimes you don't intend to use the face cover, only the mask, all that, and the N95 respiratory, but it's almost similar with the doctors.
Thank you, Guna.
Abraham, I see your hand is raised again. Did you have another question?
Yes. Maybe in the meantime to use the opportunity until the others join. Is there any way we expect a backflow on the circuit?
Are you asking specifically about ventilators?
Yeah, I mean, is there anything we expect like a backflow of the viral, on the, like the ventilators, it's a one way, definitely, inspiration and expiration. So do we expect any way that there will be a backflow or the viral load will be flowing back to the system?
That's a good question. Guna, share a bit
Yeah.
Okay.
about filters.
Okay.
Yeah.
We did spoke about filters, single-use filters. So that play very important role. The HEPA filter and HMFE filter is basically to avoid any cross infection to the device. So you won't have any backflow of infection to the device. So you need to make sure that you use this particular filter and it's a single use.
Thank you.
Yeah, and Guna, I think I recall a few days ago we were talking about an issue you had come across in Malaysia with the filter associated with the ventilator. Can you share
Yep.
the story again so that way the
Okay.
patients can adequately advise clinical users in the hospitals as it relates to filters on ventilators?
Yeah, thanks, Benjamin, to remind me that. So in Malaysia, what happened is there's an incident that you got inspiratory and expiratory line. So what happened is normally on the expiratory side, you need to fix a filter. What if you don't use a filter? There's a chances of airborne the particular expiratory output. So that can cause airborne and infect the clinical user and the biomedical. So we have an incident in Malaysia. The guy forgot to use the HEPA filter on the expiratory side. So eventually, that's an infection issue to the one of the person actually. So from 3%, 1% got infected actually. So make sure you use the filter.
And just to say it out loud, Sergey from the chat is asking if HMEF filters are reusable. Can we use this more than once, Guna?
No, normally the best thing is it's a single use. Because HMF is basically you're talking about humidity, all that. So the best to do is single use. It's always a single use device actually, these type of things. If it's mentioned multiple, then go ahead. But normally, in my experience, it's a single use because we don't want cross infection.
And Guna, something else that we've clarified in the past, I believe single use can be a bit confusing as a term, but single use normally means used on one patient, correct? Or
Yes.
one day?
Yep. It's a single use. Is normally for HMF is somewhere 8 to 9 hours, depends on the filtering rate, and HEPA filter is one whole day for single patient.
Awesome, thank you. Hannington, I think I see your hand raised.
Yeah, thank you, Erin. And thank you, everyone, for their great contributions. And Guna, thank you so much. My name is Hannington Segirinya, and I work with the Assist International. Mine is just a comment. I think during this time, this is really the best time for us to think out of the box and innovate more. So I would challenge everyone to think more out of the box and try to come up with more innovative ideas. And I think that will be very helpful. Yeah, that's all from my end.
Thanks, Hannington.
Thanks, Hannington.
Okay, we're approaching the last 5 minutes of our call. Are there any other questions?
Hello, everyone. This is Mas from Ethiopia.
Hi, Dr. Maz.
Hey, man.
How are you? Good.
Hey, Mas.
Yeah, I just want to comment before we end this session and thank, of course, Gunan and Benji and Irene from Assist International side, and also the BMS who responded to the invitation and attended this call. And I think there are some BMET groups that I shared the link, the Ethiopian BMET. So I see Abraham from Juma, and mainly from Tigray, Kaulubala, from BMET, and Sagai, Almaz. I don't know where she's from, maybe she will let us know. So I will keep sharing the link, the Zoom link in the future, in Ethiopian BME, Tigray BME, medical equipment info, which is managed by the Ministry of Health, and also the Amhara BMET group. I am very open to get more groups where I can share the link in the future, but I just say, thank you for joining this this session, and the sessions coming in the future will be more technical, and I hope that will be more interesting in the future sessions. Thank you.
Thanks, Dr. Maz. Abraham?
Yes, may I use this opportunity to thank Dr. Masresha for arranging this from Ethiopian side, and he has really shared to almost lots of Ethiopians, but we are very few to join, and I really appreciate and thank you very much. I hope this will continue.
Thank you. This might be a good moment for us to talk about what's coming next. This was the introductory session. This is applicable to all of our future sessions also. PPE and disinfection will not go away for sure. We're going to start with ventilators and oxygen concentrators next week at the same time. We'll send you another Zoom invitation. Anybody who's registered, if you've left your email for us, we will send you another invitation, and you can feel free to forward that to some of your colleagues. And then if you haven't registered, feel free to email us at HTM@assistinternational.org, and we will make sure you get an invite as well. So ventilators are next. We'll talk about patient monitors and pulse oximetry after that. And we'll also have sessions on syringe pumps, infusion pumps, and a few other topics as well. Benjamin, would you like to close us with our last minute?
Erin, I wanted to add something.
Oh, sure. Go ahead.
Yeah, Benedict from Musoma. I wanted to know the kind of equipment which are supposed to be in the isolation areas, centers, because I've seen a lot of isolation centers, and I do not know that there are standards that the isolation center should have this kind of equipment to face the COVID-19.
Great question. Guna, if you can quickly go to, I think it's one of the first slides where it lists all of the equipment that WHO recommends. I think it was after this. Right there, yeah, perfect. So Benedict, if you look at the left-hand side, this is all of the equipment necessary to surveil, triage, and then treat cases of COVID-19. You can look for more information in the WHO document that's linked at the bottom of that page. It's a bit hard to see with the Zoom bars there, but once you have the PowerPoint, this is the slide that you should reference.
Thanks, Erin. Still, I just wanted to know, because we have the centers, and those centers, I just want to know this thing, the centers and the ICU are in our regional hospital. So I wanted to know that we can put some to the centers, and perhaps if they develop the severe cases, they can be rushed to the hospital, the general hospitals of the countries. I just wanted to know, the centers should have those lists of equipment to treat any case concerning COVID-19. I just wanted to know this so that when we meet people for advice to start the isolation centers, we can tell them the centers should have this. If it doesn't have this, don't open it. Yeah.
Yeah, no, this is what WHO recommends as key or critical equipment. There are more things that would be helpful, and you can probably also get away with a bit less in some cases. But ideally, the center would have everything on that list. Quantities would vary by the number of cases for sure.
Okay, thank you.
want to add to that at all?
No, that was good, Aaron. I just wanted to say, Benedicto, with depending on the kind of care they want to provide, as you had mentioned earlier, patients who have much more severe symptoms, like respiratory distress or failure, even, they need access to ventilators and high parameter patient monitoring. And so, but some of the other facilities, I know in rural Tanzania, they're looking at dispensaries. They may just need some basic patient monitoring around, say, body temperature, things like that. And for patients with milder symptoms, they may not need, an access to ventilators necessarily. So maybe even take it offline. We can help you think through what kind of equipment set they may need at a dispensary versus what they may need at the referral hospital that you're working at.
Thank you.
Good. Well, I think we've come to the end of our time today. I want to thank everybody for joining. As Aaron Guna has mentioned, this was just an initial introductory session on PPE and disinfection. If you have any more questions, don't hesitate to email us at the email address Aaron has put down in the chat. It's assisthtm@assistinternational.org. We're happy to send out the slides to everyone. And don't forget to actually put some of this into practice. Don't let it just sit on these slides and in a recording. Be sure to observe proper hand hygiene, disinfect your hands, sanitize your hands, wash your hands frequently. Before and after you wear gloves. Be sure to wear your goggles and your gowns. Don't forget your shoe covers. Take good care of yourselves. And in the coming sessions, as Dr. Mazershaw mentioned, we will have more technical sessions starting next week, and we will delve into the maintenance of a ventilator and all of its components, as far as reusable and disposable components, and ensuring that these devices are safe for patient use. So you are all a key part of the solution, and we want to do everything we can to connect with you and make sure that you have the resources you need to help your health facilities. So thank you, everybody, for joining today. Thank you for your time. Spread the word. We'll see you again next week at the same time.